Welcome. I'm Ted Burke, Director of Illinois' Early Intervention Training Program. Today we're going to take a look at early intervention services from a different perspective, that of the family's perspective. We've talked to a number of families throughout Illinois who are going to tell us their story about how early intervention has affected them, their children, and their overall lives. Let's first take a look at how families got involved in the early intervention system.
My wife originally worked with the early intervention system, and she had coordinators set up to take care of them.
Well, I've had two children actually go through the system. My first, who is 6 now, I was sitting at a service coordination training, just starting my job as a service coordinator, and was at a training that was talking about outcomes, and one of the outcomes was to help the parents sleep through the night. And I thought, who can help us with that, because she never sleeps through the night, which means we never sleep through the night, and we were all very tired. She was 2.5 at the time. So I started asking more about that and made a referral, and actually had occupational therapy and social work come out and help us make a schedule for her and put her on a listening therapy program that calmed her more, and it worked absolutely wonderfully. So that was her story, and then she aged out very quickly. Then we had our second child, our son, who was about a year old and not saying anything, and I was still a service coordinator at the time, and so around 18 months, after sitting on my hands for 6 months, I decided to get some referral made and get some speech therapy and a global on him, and he ended up having a very large delay in expressive speech. And so we started with speech and developmental therapy, and then he ended up having some sensory issues and picked up OT along the way. And then he started having some behavior issues, so we also picked up some a developmental therapist that specialized in behavior. And then he also transitioned into an early childhood program when he was 3, and is still doing that right now.
My daughter was showing signs of not hearing well or understanding. And we were questioning her ability of speaking, and our doctor had recommended us to the early intervention.
My family and I got involved in early intervention when my older son Diego was referred when he was about 2 years old. He was receiving therapies at a clinic, and the insurance was paying for it, and the therapies after he was referred, the therapist started coming to our home to do the therapies.
Our family got involved in early intervention through a mom I met in a mom's group. She was a developmental therapist herself, gave me the number of Child and Family Connections, and I called the coordinator, and they set it up and had all of the domains come out and look at Don, and we found out that he had a significant amount of delays, and he qualified for all of the services.
We got involved in early intervention in 1990 when Augie was born. He was born with some health problems related to his heart, and then he was also born blind. So I'm going to say by the first month we got the baby home, and we have nurse came to visit us because of his health issues, the heart problem. And at that time she asked me what was it that I needed to help my son. And I loved her forever because of that, because she didn't tell me what I needed to do. She asked me what I needed. And what I asked at that time was, I really need to meet a grown-up that is blind and is successful. I never knew anybody that was blind until my son was born. So she was great. She put me in contact with people that I'm still friends with. And after that, I felt confident enough. I was able to recreate the dream for my son. And after that, I was able to say, now I'm ready for early intervention. So we met the people that we had an IFSP set up, and at the beginning, the therapists were coming to my home. I was receiving physical therapy and occupational therapy, and then eventually they had a center-based program, so I was able to start going to that program for a few hours a day. And I remember the first time that I put him on a yellow tiny bus, how much I cried. There was my baby leaving me. But he did wonderful. It was a wonderful, wonderful experience with early intervention.
No, I really didn't. I really wasn't sure originally being introduced what we were supposed to do, if we'd be required to do more, or if it was our fault really. So it was nice to actually see a third party come in and tell us what's wrong and what needs to be done, and how good they are doing, better than we probably thought they were doing.
I was kind of surprised that it was out there. I had no idea that there was an early intervention out there. We were just dealing with the problems at home, thinking that it was normal.
What were the first impressions families had when they entered the early intervention system?
The first impression I received from meeting with my service coordinator for early intervention of the system was that I knew this was going to be something great for us. I was very excited that it was so adaptable to our family. I was excited that these people would be coming into our home. I also was quite shocked. I had been a teacher, and I had never heard of such a system set up for kids 0 to 3, and I was just very excited to be a part of it, and I knew that it was going to work for us.
Well, because I was a service coordinator also at the time, I kind of knew what the early intervention system was going to offer us and what the system was about. But as I learned more, because we started right after I started being a service coordinator, and I was learning my job along with learning what the system was about. So our first impressions was that it was going to offer us a lot of opportunity to get the things out of our daughter that we wanted to.
I was impressed. They listened to what we had to say. They focused on what we wanted to do and where we wanted to go, and also developed things that we could do in the home to help them. Gave us ideas to help them.
I was very impressed with the system. The system had it was very surprising to see that a program that reaches out to families.
It was a lot more convenient for me. It was difficult for transportation for me to get to and from the clinic, and it was a lot easier for the therapist to come to my home.
Well, when I first got involved, I was referred from a friend. I was working with foster children with special needs at the time, and a friend of mine joined the early intervention system to work for it and said this is a good job. So then I followed her into service coordination and started working for it. So that was my actual first experience in the early intervention system. As a parent, it was wonderful because I did have at least a small background at the time of what the procedures were and the policies were and kind of how we had to do things and make things happen. But I didn't know a lot of the therapists and did have some good experiences and bad experiences with picking my therapist and having qualified people do it. So the second time around, when my son came into the system, we knew exactly what to do, and I had a large array of people that I could have chosen and ended up picking up very good therapists and felt very comfortable with our entrance into the system.
At what point did families first realize how important their role was as a part of the early intervention system?
The therapists that were giving therapy to my older son Diego started informing us how important it was for families to start joining the early intervention program. They were the ones who encouraged us a lot. And for my second 2 sons, they were the ones who did the initial the process of the evaluations.
It was really important when my son was born that I was listened to and accepted with my own beliefs, with my own strong feelings about some things. I wanted my husband to be part of everything from the beginning. I was probably the first person in that early intervention, with that group of early intervention providers. I was probably one of the first people that was from a different country and a different culture. So it was interesting, but I always felt well accepted, and I always felt listened to. So that was a really nice feeling. So I felt part of the team from the very beginning. That was really good and important to me.
It keeps parents at ease and the rest of the family at ease, even if it's the grandparents, which are usually involved a lot. My parents were involved, and it helps everybody be more at ease and get through the system better without being scared.
You know, really it came from the therapist. Being in the system, being an employee and the service coordinator of the system, it wasn't me who thought that families were so important until I had a child in the system, and my therapists were like, you need to be involved and you need to listen to what we're saying, and we need to have some follow through, and you need to, do this during the week, and here's some homework, and hopefully that, he'll gain from your experiences of what we tell you. So it was really my therapist that, brought it down to how important it was for me to be involved.
I didn't want to be left out and just have the coordinators and therapists actually handling the therapy. I wanted to actually be involved, and that way we could give our input and show where we could be a help to our children. So it was nice to actually see that we would actually be involved.
The service coordinator was probably the first person that spoke of it. However, that day there was a lot of information being given to me, so it wasn't really until the provider started coming to my home that I really got the true understanding of how important family was in this, and how much we walked hand in hand together through this, and all of the support that they were giving us, we had to back up at home on a consistent basis.
Let's hear from some families on how the IFSPs were developed with their concerns first, not that of the providers.
We had issues with my daughter being very emotional. We explained that she was crying a lot and needed help in dealing with her emotions and her sensory issues. And they seen what we were talking about, and they knew when we told them what we wanted to actually take care of, and that way they could see it. With my son, they understood that we wanted him to be speaking more, using more of his words, using his syllables better, enunciating, and they understood that when we explained that, and that was nice.
Our priorities drove his IFSP from the start. It was really our priority that he had a real lack of expressive speech that got us going, and so the first outcomes were driven towards the lack of speech. But as we went through the system, he was in the system for about 18 months, so as we went through the system, our priorities changed to more of a behavior base. His speech was improving, but not as rapidly as we'd like. But as we tried to get his speech to improve, his behavior went downhill, and he became, more aggressive and kind of mean towards his sister, and wouldn't follow directions and do a lot of different things. So we switched our priorities from a major only expressive speech outcome to incorporating a lot of behavior strategies, and they listened to that.
From the beginning, from my first phone call to CFC, I was presented with the question of what are your concerns and needs. So from the beginning, everything that we've set forth for our son has been driven by the reasons for us calling, which were based on his lack of communication and him being a late walker, his gross motor development. So as all of the therapists came into our home to evaluate him, everything that they tested him or evaluated him on was based around those concerns. And surprisingly, then we also found out that not only were those delays a concern, but there were several other developmental delays. So along with our main concerns came concerns of the therapist.
The therapist, for the initial therapies, the therapist gave us a call to let us know how our schedule was, for them to find out when was it more convenient for us to have the therapies. It's very important that the early intervention programs are catered to the parents, to our schedules, to the child's needs, to what we believe are his needs also. And the therapists work around that too.
Our meeting, our IFSP meeting, was in my own home. Our speech therapist came to our home, the developmental therapist came, and the service coordinator came into the home. They evaluated my daughter in a sense where if I was watching them. And I was quite surprised at how it all came about, to tell you the truth.
Let's look at some partnerships that were developed between families and providers.
I think my service coordinator is great. I think she is very involved in what our family is looking for, and she's really trying to work with me knowing our schedules. I work full-time, my husband works full-time. She's trying to, I think, go the extra mile in trying to find a time and a time for our speech therapist to come to our house.
It was give and take. We said what we were doing, what we'd like to see done. They gave us ideas on how to better play with them, to get them to better understand, or to use different toys and puzzles and word games, things like that. So they gave us ideas to help them, and we gave them ideas to show what was working and what wasn't.
My relationship with the providers and the service coordinators is quite amazing. I feel like I have met new friends, as well as qualified people that have been evaluating and servicing my son for the past year. Our relationship is great. We constantly work together. All of the decisions made for Don are through my concerns as well as through their concerns, and I could not have asked for a better program or a better people to have met to gain more than just teachers coming in and working with Don. It's gone up and beyond that.
As a service coordinator, I really worked with my service coordinator in the office, as I was a service coordinator as well. So we had a relationship on a daily basis, which was nice because when I wanted something done, it got done right away. So which is a little bit different from most families. With our providers, though, we had an excellent relationship. We had wonderful communication. They listened to everything that we wanted. They took our ideas and strategies and incorporated them into things that they were learning about and their experiences. And we had a definite communication with the center base. He went to a center base once a week. The therapist, one of the therapists was at the daycare once a week, and then we had 2 hours at home a week. So we try to keep communication with everybody that was dealing with Hayden at the time.
My service coordinator is great. If I have a problem, I go to her. If I feel I'm in overload, I'm getting ready to have a breakdown, I go to her. Currently, with so many therapies that I'm having with my kids, I had a situation where it was just too hard to handle my house and my kids, and I went to her, and she's kind of walking me through the process of getting some help into the home.
How have families felt services were incorporated into their daily routine so that they didn't have to go from service to service?
Another unique circumstance. Early intervention from the start had done everything based around our daily needs and the way that our schedule ran. So from the start, anybody that walked through our door was immediately concerned with, is this going to work for us? Is this not going to work for us? So all of our therapies, any of our meetings have all been based around our day, and there has not been one instance in which anything has been set up that would not have worked for my son's schedule or for our family's schedule.
It was very important for us to have our daily routines incorporated into all the strategies and all the therapeutic things that were done because we had such a busy life at the time, and he was in daycare 3 days a week and he went to a center 1 day a week. So we incorporated many of the behavior strategies into the daycare, and she followed through on those strategies for us as well as what we did at home. And we also had a communication system that he was working on, that we worked on at home during dinner time and during when we woke up, and he had things that he had to do and things that we also had to do to incorporate it into our lives, and so did the daycare. So everything was incorporated into his daily life and all his daily routines.
It's unbelievable. I think we're at a point where we're in disbelief that this is out there, to tell you the truth.
Here are some examples of how providers and families have shared strategies back and forth so that the services met the child's real needs.
Don's providers and myself have shared an enormous amount of strategies back and forth to make sure that he's getting the adequate services that he needs. One of the biggest things I think that has helped along the way is that EI is so family driven that every time those providers are in my home, I'm down on the floor with them, I'm seeing them work with him, I'm seeing the strategies they use, I'm able to then incorporate those into the time when they're not there. I've become so close with our providers that I've even attended a couple of conferences with a couple of them that have asked me to go. So then again, that's more time together talking about things at the conference that would work for our son, that wouldn't work for our son, and it's been a real positive experience.
Our providers shared a lot of strategies with us as they went to trainings and as they researched the different things that we wanted to see happen. They would bring us ideas, as well as my husband and I researching different ways that we would like things to work, and as we implemented strategies, things that didn't work and things that did work were brought up on a weekly basis, and how we were going to improve them or how we were going to change them to make them work for him.
Let's hear how families feel that they've been listened to by their providers and that their concerns were met and that services were tailored to their needs based on what their specific concerns were.
They listened intently, and they understood what we were trying to get through and what our goals were. And I seen that by them giving us goals and showing us what they wanted us to do, and it showed that they were listening to what we were trying to say.
I definitely got the feeling that our service coordinator, our speech therapist, and the developmental therapy therapist had listened and actually really cared. I mean, I really felt in the beginning when I talked with our service coordinator, I actually asked her what were their qualifications, how they can assess a 2-year-old. Well, you know, that's one of your first questions that you first think of, is how could someone come in and say, oh, your 2-year-old doesn't hear or doesn't do this or whatever. But I asked our service coordinator, and our service coordinator, he had explained that each person has their qualifications, and they have to go through a training and schooling, and it's just not somebody off the street. It's someone that is through the program, and I appreciated that. I really did. I felt okay, and I think when they came to our house, I was more. After the IFSP, I was more relaxed and saying, you know, this is really great. This is really great.
I absolutely think that the entire team has always listened to me. When I think back about any evaluation that's been done on Don or any assessment, one of the first questions has always been, Mom, what are your concerns and your needs for Don? And they have always been addressed first and foremost, and then we've worked together to develop the goals and the strategies for Don after my concerns have been met.
When there are disagreements, how are those disagreements resolved?
Well, one disagreement we had with the speech therapy not too long ago was that she works in a school setting. So the summertime, she doesn't do therapies, and my son needed therapies during the summer. I went to my service coordinator, and I just arranged for somebody else to come to my home.
Well, I think it's interesting because now that I'm working with families in the early intervention system, I think we need to help families understand their rights and their options from the very beginning. In looking back at my experience, I don't remember if I was explained the options. Possibly I was, but I wasn't ready to listen. So as my child exited early intervention, then I knew that I would have liked to have things done different. I didn't know when it was happening. I just went along. Although I was able to express my opinions, but I don't think I even knew exactly what I wanted. And probably I was explained. I think I wasn't ready to listen. And I think that's why it's important as we work with families and families with very young children, some of whom just received diagnosis, that the options are offered several times along the way. It's not a one-time deal. You don't give the rights to the family only one time and you expect them to get it at that time. You don't offer support. Do you want to meet other parents only one time? And if the answer is no, you don't ever offer again. Because as we travel through that journey, as our child grows, And as we get more confident and we learn more, our needs change, I think. And so I think I would have liked, if I had to do it all over again, I probably would have liked to hear my options often on those 3 years of early intervention, often enough, because I know I changed as I moved forward, but probably I didn't even know what to ask for. I wasn't ready to ask.
We had really wonderful communication between all our providers that dealt with Hayden, and for a while there was quite a few different people that were involved, either on a consultative basis or on a direct service basis. So if there were times where we disagreed with the strategies they'd like to implement because it was just not a good idea for the family at the time, or it was just going to take up too much time of our daily routines, we would be able to resolve those problems and resolve that through communication. But if you didn't have a good relationship and communication with your providers, it would be much harder to resolve those problems.
I actually love this question because fortunately for us, we have had zero circumstances where there have been any negative aspects that have arisen where there'd be any reason to have anything to have to rediscuss or feel negative about.
What skills did families feel that they gained by being part of the early intervention system?
I think, for one, to better see how much progress they are making and understand the steps that they need to go through to get to other goals, that you need to get through one step before you get to another, and just understand that they are making progress even though you might not see it because you are seeing them every day. So with the third party coming in and the coordinators coming in, they could see that you were achieving the goals since they were all written down and everything, what was being achieved, that they won't that the child is actually achieving something even though you don't think they are all the time. So that's what I learned, is to actually see where the progress is being made.
We learned a lot about Hayden. We learned a lot about the way he does things, the way that he learns, the way that he understands, things that we probably would have not known if there weren't experienced therapists coming into the house and pointing things out to us. Our parenting skills improved just by the way we handle his behavior. Our parenting skills improved by the way we implement strategies to enhance his communication, and they gave us a lot of ideas that we are still working on now that he's almost 4, that we were working on when he was 2.
We certainly learned a lot about our son. In the beginning, after all the therapists had done the initial evaluation on our son, it was very hard to accept the fact that not only were there a couple of things we thought he was delayed in, but there were many more. And in the beginning, it was very hard as a parent to accept that. However, through all of this past year and all of the therapies, our son has made fantastic strides, and the biggest thing we've learned is that he's quite a little sponge, and that we hope he'll continue and develop as well as he has.
The thing something that I thought that was normal was for a child to begin speaking maybe between the age of 2 or 3. The physical therapy noticed something wasn't right, that he wasn't developmentally properly aged or wasn't at the right stage, so she got him to get evaluated.
What skills did families feel that they gained by being part of the early intervention system?
I've gained quite a few skills being involved in the early intervention program. I think the biggest skill is I've been instructed on how to work with a child with special needs, and I've been very fortunate to have a great team that has supported me and a great team that has helped me to be the best mom that I can be for my son. And these people have also given me the ability to seek out a new profession and possibly become a developmental therapist myself. I have gained so much knowledge from them. I've gained knowledge from different conferences and workshops I've attended to become this better mom, and the whole experience has just been very positive for me. I've taken a lot out of it.
I think we gained a lot of education and experience in birth to 3 and kind of just what happens in the development of a child in general. We had an older child that had many different milestones and many different experiences in her 0 to 3 years than Hayden had in his 0 to 3 years. And so just learning all about the different ways that 0 to 3 and birth to 3 kids can learn, and the different ways that we implemented strategies and just the education and experience that we got out of the whole 18 months we were involved.
Some of the skills I learned through the early intervention services that I've received through therapies were the proper stages of developing, the children developing, and a little more medically knowledgeable on what's not right and what's going on with my kids at certain times, what they're doing when they're doing them.
I think it was a great experience for me. I learned a lot. I learned that I was valued and I had a say-so and I was listened to. I learned a lot about my son through the experts. I always knew him, and I still know him, and I think I know him better than anybody, except himself probably, and he will correct me that he knows himself better. But I learned, I learned to discuss his, perhaps his needs in some area with the physical therapist, and I learned to understand that perspective and incorporate that to the way that I saw my son. I learned to work in a team. That was really important to me. I think I wasn't prepared for that. This is my kid and I need to overprotect him and I know better. The team in early intervention helped me find my spot in that group, and not only I felt that I was able to be part of the team, but I also learned to listen to others, incorporate opinions. That was really important to me.
Since our original meeting, what I have learned is that different techniques of trying to incorporate of how we're teaching her. We're trying to make her understand. She has a problem understanding as opposed to hearing. We thought it was hearing. So now we have to work on understanding and teaching her those ideas of understanding.
Probably patience is a big one, to just take your time with them, with the child, and better deal with their issues and deal with other kids' issues. I think because if you don't have patience, then you're not going to be able to deal with their lack of skill. So if you got patience, you can better deal with a lot of things that are going to come along during the whole goal-oriented issues.
The best thing about the early intervention system for us has been the relationship we've gained with the therapist that has been never ending. He's been, a year and a half into early childhood, and I still call the early intervention therapist that we have, the speech and developmental therapist and the occupational therapist, when I have questions about what's going on with him now. The relationship that I have with Child and Family Connections, knowing that I can call them for resources and talk to them about any future problems I might have maybe in the school system, and how to gain advocacy and how to call people, and just the resources and education that we've learned.
I think the best thing about the early intervention system is that it helps you make goals. It helps you achieve your goals. They give you strategies to go by. You're not just alone. You actually can bounce ideas off of other people. You can decide where you want to go from one goal to the next, and that way you're better getting to where you need to be with your child.
The best part of the system is to know that a program is out there and is willing to work with you and actually come to your home and not interrupt our other daily functions. Just for instance, coming after work, having someone scheduled to come after work instead of getting home, racing home, taking our daughter somewhere and just being rushed. We're not rushed. They come to us.
The best thing for our family about the EI system has been the extraordinary gains that they've given to our son. The providers have been absolutely consistent in their work. They've been caring. They absolutely adore him. My son loves when they walk through the door. They have given us a lot of hope, and I think that if we would not have stumbled upon them, we definitely would not be where we are today, and probably would not be able to be so positive about the future either.
Early intervention programs have meant a great deal to my family. My children have all received quite a bit of help with it. They've all progressed. I've seen the progress. My older one, when he was in the hospital after his surgery, the doctor said he wouldn't be able to do a lot of things that he is now currently doing. I get a lot of support from his therapies, and they encourage us and him.
As a parent, it's been very important that the family is involved. I don't think in our circumstance that Don ever would have gone as far as he had gone without understanding that it was really our responsibility to maintain and follow through with what the providers were bringing into our home.
Being in the early intervention system has meant to our family many things, that we're not the only ones that have a child or a son that has delays. He doesn't have a diagnosis, but he still struggles with communication. He still struggles with behavior. We've met many parents along the way that have also had children similar to his degree of delay. I've become more involved with the system in working with other parents, and so have gained a lot of skills for helping other parents talk to their providers and talk to their child and family connections, and hope to be a help to other people.
Getting my kids and my children into the program means to me that they're actually achieving their goals. Their progress is a lot farther than I think it would have been without the system. They've now gotten in school. They're achieving everything that they should be achieving, and really progressing very well.
If there were no early intervention services for our daughter, we're not sure where she would have been. She was 2.5 when we started, so a very late start, but she had a lot of emotional problems and calming problems and wasn't sleeping through the night. And within 3 or 4 months, she was sleeping completely through the night. We're having a lot less difficulty with her. We were using an assistive technology listening therapy program that we would have never implemented without early intervention, that she still uses to this day, and she's 6 years old now.
As a parent, it has been a real blessing. They've actually helped me and my wife get where we need to be with our children. We've seen that they are actually making a lot of more goals than we thought they were originally doing. So even though the system actually sees where your children are lacking, it's actually helping you to see where your children are actually performing very well.
It's helped as a parent to know that you don't have to know everything coming into being a parent. There are a lot of parenting skills and different strategies for educating your child, and different strategies for helping your child learn best for the way that they learn best, that you might not know, even thinking that you are a really good parent. And you learn that from your therapists that come into the home and work with you in early intervention.
I didn't know anything about intervention. I think without intervention, we would not be where we are today. Augie is included in regular classrooms, have been from the beginning. I was able to learn, I think, not only help my son with all what he needed to grow developmentally and catch up with peers of his age, but I also think me as a parent, I learned to be part of a team, to learn my rights, to learn the rights of my son, to request, to join teams and make plans and develop. I think it meant a lot. It meant a lot for us as a family. And I think Augie is where he is today because our intervention was there when we needed it.
By getting into the program, it feels that I know that we're working with her. We're doing everything that we can to have her understand and speak. Speak better, I should say. Talk more words. I think that down the road it will help her be on a normal level.
If you're a parent considering whether or not the early intervention system is for you, I don't think that you should hesitate a second more. This is nothing that could ever hurt your child. They bring nothing but positive experiences. They're all about you. They're all about your child. And you will not find any other system that will be family-based and ready and willing to work with and for you.
Other parents, I think, should get in the program because it's helping you to achieve your goals. You're not alone in the system. You can bounce ideas off of other people, and it's very well structured. So you're not just going off in different areas, and you're actually achieving something.
I would encourage families to get into the early intervention program. It has helped my family, my kids. I've seen the progress. I've seen my kids do things doctors have said they would not do. I would really encourage it.
Well, now that I know it's available, I think everyone should do it. If you have a need for it, I think that it's great that it's offered. I think that it should be more advertised or more aware of it, such as at doctor's offices. I would have never known about it unless my nurse practitioner suggested this is a great program. Go after it. If you have any doubts, they will assess it.
I think it's very important to get your child involved in the early intervention system as soon as possible, either when the doctor sees a concern or you see a concern, because the earlier they start, the further they'll go, and we've seen that with Hayden, that he has gained a lot of skills being in early intervention for 18 months, and he is still in early childhood, but he would have been in early childhood anyway if we would have had him screened, and he would be further behind the other kids.
If a parent has the option today to choose early intervention or not, having a child that needs it, I would say go for it. Learn your rights, learn to ask, request information, and don't be afraid. I mean, just go for it. This is a wonderful experience. You will be able to create a plan for your child with your dreams in mind, and it will help you tremendously, because after you leave early intervention, really the system changes a lot. And I think as parents and as families, we have a lot to learn, and if you start early when your child is young, it's going to make a big difference in the life of the family as a whole, and definitely your child with disabilities.
I would say to other parents that it's something that you really don't believe that it's happening to you, because you think that there's nothing wrong with our child. But it's not. The program's not all about that. The program is to assess if there's something that just needs a little bit more tweaking, or something that, yes, we need to work on something instead of another issue. That we were focusing specifically on hearing. Now we need to focus on something else. I would tell the parents it's something that the program is out there. I would more than welcome it.
Early intervention would not be what it is without family. The therapists are wonderful. They come in for us. They've been coming in to 1 to 2 hours a week for Don. And if the family was not involved, I don't think the kids would be able to progress with the best strides that they're capable of doing without having the family involved. There's just no way that if the parents weren't involved, there'd be nothing done then at home on the side, and I just don't think that kids with special needs then would develop to the best of their capabilities.
You can't always be someplace at a time somebody else needs you to be. It can't always be in the morning, can't always be at night, and both parents can't always be there. So it's nice that they can work around your schedule and make sure to get what your child needs when they need it.
It's very important that the early intervention system works around our family, because we're very consistent with our routine, and early intervention adapts itself to that. This wasn't a program where they came in and said you have to change everything that you do in order to get these services. It's been absolutely wonderful to have them say what will work for you, we'll figure it out, we'll do this, and they do it at times that are acceptable. They've never come and interrupted my son's nap, they've never interrupted his eating. It's always been at times where he will be the most cooperative and the best work can then be done.
Thank you for taking the time to view this video. If you have additional questions, please contact the Illinois Early Intervention Training Program at 866-509-3867.